Hair loss can happen for many reasons, such as nutrient deficiency, hormone changes, stress, medication exposure, systemic illness, and infections. Two common hair loss disorders that have this sign of patchy hair loss are alopecia areata and trichotillomania, and topical minoxidil or steroids injection on the affected area is the most common treatment to help hair grow back on the bald spot. However, the success rate varies case by case, and some treatment is not suitable for children. Hi, I'm Antonio with VitaHelix. Today, I will share with you the remarkable results on 3 clinical cases where the patients were suffering from trichotillomania and how they regrew the hair in non-invasive way. Before we start, don't forget to subscribe to our channel to get more study reviews on the dietary supplements. And if you like this video or if you think it's useful, hit the like button and leave your comment below. We would like to hear your feedback. Let's get started. Trichotillomania, also known as a hair pulling disorder, is a compulsive action of scratching and rubbing of the scalp, and an urge to repeatedly pull out one's hair, resulting in fractures of the hair shafts. This disorder can be mild and manageable, but sometimes it can be severe. In the severe case, it can lead to Lichen simplex chronicus. This is a skin disorder characterized by thickening and leathering of the skin as a result of excessive scratching and rubbing. The scalp is one of the most affected sites, and itching is the main symptom. According to the scientific research, the peak of incidence for this condition is between age of 35 to 50, and it happened more frequently in women than men. The most common treatment are topical and corticosteroid injections on the scalp, but this painful method is not always successful. Plus, not many people can endure 8 injections on the scalp in each appointment for at least 4 to 6 months treatment. Then, here comes the question. Is there any non-invasive or mild way, such as taking a dietary supplement, that can help reverse this uncomfortable condition? The answer is yes. The supplement that successfully helps with the hair growth is N-Acetyl-Cysteine, also called NAC or NAC. NAC is a supplement form of the amino acid L-cysteine found in the human body. By taking NAC, your liver will convert NAC into cysteine, which in turn will be converted into glutathione to support your body's immune system and help to protect against DNA damage caused by free radicals. Using NAC as a treatment for hair growth has shown promising results in mice and humans. Today, we will take a closer look at 3 clinical cases of hair loss and the subsequent hair regrowth by NAC supplementation on patients suffering from trichotillomania. The 2 first cases were reported in the Journal of the European Academy of Dermatology and Venereology in 2016. The first patient is a 30-year-old female with 1 month history of hair loss on the front and top of her head, as you can see in the figure 1A. A dermatologic examination showed a 20 cm diameter, irregularly shaped bald patch with shorter hair of different lengths on the front region. After treatment with oral administration of 1200 mg of NEC daily upon diagnosis of trichotillomania, the hair pulling behavior gradually subsided and the following 2 months, as you can see in the figure 1b. Astonishing, complete hair regrowth was observed within only 4 months. No adverse effects were noticed and NEC treatment was discontinued. No relapse was observed after 7 months. In the second case, a 14-year-old girl presented with 2 months history of asymptomatic hair loss over the crown, as you can see in the figure 2. She had a history of ADHD and has been treated with haloperidol for 6 months and methylphenidate hydrochloride for 3 years. She had been habitually ripping out her hair, and this behavior was aggravated by psychological stress. Dermatologic examination revealed a 10 cm diameter bald patch shown in the figure 2a. Upon the diagnosis of trichotillomania, the same NEC treatment, 1200 mg per day, was initiated. The haloperidol was discontinued. After 2 weeks, there was a significant improvement in the hair pulling behavior. Surprisingly, a complete hair regrowth was noticed after 6 months, as you can see in the figure 2b, and NEC treatment was ended. At 8 months follow-up, she continued to abstain from hair pulling and the behavior did not recur. That's amazing when a supplement really works. The third case was reported in the Journal of Skin Appendage Disorders in 2019. In this report, a 47-year-old man with 8 years history of intensively itching spot on the right side of his head. After 4 years, 2 new intensively itching spot arose associated with hair loss in these regions, as you can see in the figure 1a to f. Initial treatment was carried out with clobetasol cream twice a day. However, no improvement was found. The patient rejected mental counseling and refused further topical treatment. After that, his doctor prescribed him with 1200 mg daily of NEC. After 8 weeks of treatment, a partial improvement was observed already, and the complete hair growth was found in all patches after 16 weeks, as you can see in the figure 2a to f. It's worthy to mention that the patient significantly decreased the impulse to scratch the hair. At the 3rd week's follow-up, the response to the treatment was maintained. No adverse effect was reported. These 3 clinical case reports mentioned here are not clinical trials, but again, for these 3 people, supplementation with NEC have made a huge impact on their hair growth and brought them back to their normal lives. I thought it would be interesting to share this information with you. N-Acetyl-Cysteine, or NEC, is one more powerful dietary supplement. Hope you like this video, and as always, stay healthy and live longer.